Ever pondered about the use of Abilify, also known as aripiprazole, in teens and preteens? This is a topic that has been under discussion for a while in the medical world. Today we're going to delve into this subject, shedding light on its benefits and risks in an unbiased, balanced manner. Firstly, it's crucial to understand that Abilify is an antipsychotic drug. It's primarily used to treat conditions like schizophrenia, bipolar disorder, and in some cases, it's even used to manage irritability in children with autism. But how does it work? Well, Abilify helps to restore the balance of certain natural chemicals in the brain, such as dopamine and serotonin, which can help to improve concentration, reduce hallucinations, and improve mood and behavior. Now, let's talk about the benefits. For teens and preteens struggling with the aforementioned conditions, Abilify can be a game changer. It can help to manage symptoms and improve daily functioning, allowing these young individuals to lead a more normal and fulfilling life. In fact, some studies have shown significant improvements in youths who have been treated with Abilify. However, like any other medication, Abilify is not without its risks. Some of the common side effects include weight gain, drowsiness, nausea, and vomiting. There's also a risk of developing tardive dyskinesia, a condition that causes uncontrollable movements, often around the mouth. In rare cases, Abilify may increase the risk of suicidal thoughts and behaviors in young people. It's also worth noting that the FDA has issued a warning about the use of Abilify in elderly patients with dementia-related psychosis, as it can increase the risk of death. Furthermore, there's the issue of off-label use. This is when a drug is used to treat a condition for which it has not been approved. While this practice is not uncommon, it's important to remember that it should only be done under the supervision of a healthcare professional. This brings us to the topic of informed consent. Before starting any treatment, it's paramount that both the patient and the parents or guardians understand the potential benefits and risks. This allows them to make an informed decision about whether to proceed with the treatment or not. To recap, Abilify can be highly beneficial for teens and preteens with certain mental health conditions, helping to improve their mood, behavior, and overall quality of life. However, it's not without its risks, which include side effects and the potential for increased suicidal thoughts. Off-label use should be approached with caution, and informed consent is a must. Remember, each individual is different, and what works for one person may not work for another. Therefore, it's always important to consult with a healthcare professional before starting any new medication. And that wraps up our discussion on the use of Abilify in teens and preteens. It's a complex subject, but it's one that's worth understanding, especially for those who are considering this medication for their loved ones.